Dr Mohammed Al-Wais is working at the Coombe Women and Infants Hospital in Dublin, Ireland. He's come from Pakistan as part of an innovative scheme to give foreign doctors specialist training. When his 2-year stint here is over, he will return to Pakistan.
As per my contract, I have to go back home after completing 2 years of training and get my fellowship degree and try to implement good things, positive attitudes over there in Pakistan.
Ireland devised the scheme as part of its plans to implement the WHO Global Code of Practice on the international recruitment of health personnel. Since the code's adoption in 2010, what global progress has been made? Dublin, the capital of Ireland. For many years, the country has been one of the world's top destinations for migrant doctors and nurses. OECD figures show that over a third of doctors in Ireland are foreign trained, and many of them from low-income countries. However, Ireland itself loses many of its own trained health workers who emigrate in search of better jobs.
We know that internationally we are particularly dependent on foreign trained doctors and nurses to carry out tasks in the delivery of our health service in a way that's very skewed compared to the rest of the world. We know that within the OECD, I think we're the country with the second highest dependency for overseas trained doctors and the highest dependency for overseas trained nurses.
The demand for healthcare workers in every country of the world is rising phenomenally. We anticipate that with the aging populations, with the emergence of non-communicable disease, that there will be a requirement for increase in the quantity, quality and relevance of the health workforce.
To try and adhere to the WHO's 2010 Code of Practice, Ireland is developing plans to strengthen its domestic workforce and handle international recruitment in a more ethical manner.
The International Medical Graduate Training Initiative is a 2-year programme where trainees come from the training programmes in Pakistan. While they're here, they're still registered with the college in Pakistan. Their training here is recognised by the college, so we're not prolonging their training. And then ultimately what we're hoping is that they will go back to their own country and that we're not depriving that home country, in this case Pakistan, of a really precious asset.
I've learned most of the things which we only used to read in books and literature. We are practically seeing those new things, new machines, the drugs and every technology which we used to read in books.
The upcoming doctors in Pakistan, as a big brother, I can tell them, that you do research and implement, good positive things. Here, most of the infections are being prevented by the hand hygiene, 5 moments of hand hygiene according to WHO. In my country, the basic problems are infections. So if we do hand hygiene and antibacterial techniques, antiseptic, non-touch techniques in back home, we can prevent half of the diseases. As a single person, it's very difficult to bring about the change in a region, in a country, but at least I can participate my own role.
Since 2013, around 200 doctors have been trained under the Irish initiative. It aims to uphold one of the core tenets of the WHO's Global Code, that low and middle-income countries should not be deprived of health workers in order to fill gaps in the workforce in other countries. Progress has been made in Ireland and internationally, but there is considerable work still to be done.
It's really important that countries adopt the code actively, and that may mean that different countries develop different policies by which they, as individual countries, enact the code. Our International Training Initiative is one example that could easily be adopted by other countries. I think the important thing is that there is an active approach taken at a policy level, at government level, innovative approaches which can ultimately be shared then by other countries. And that's why we're very proud of this training initiative that we have introduced and very happy to share our learning with other countries who might find it beneficial to them.
Thousands of miles away in India, Nurse Regula Raj is planning to emigrate to Europe. She explains why.
പുറത്തേക്ക് പോകാനുള്ള പ്രധാന കാരണം കേരളത്തിലെ കുറഞ്ഞ സാലറിയാണ്. കുറഞ്ഞ സാലറി എന്ന് വെച്ചാൽ പ്രൈവറ്റ് ഹോസ്പിറ്റലുകളിൽ നമുക്ക് 12,000 രൂപ വരെ മാത്രമേ ശമ്പളം കിട്ടത്തുള്ളൂ. അത് വെച്ചിട്ട് നമ്മുടെ ലോണ് അതുപോലെയുള്ള കാര്യങ്ങളൊന്നും അടഞ്ഞു പോകത്തില്ല. അതുപോലെ തന്നെ നമ്മുടെ ജീവിത സാഹചര്യങ്ങളും. പിന്നെ യൂറോപ്യൻ കൺട്രീസിൽ പോയാലുള്ള പ്രയോജനം എന്ന് വെച്ചാൽ നമുക്ക് നല്ല സാലറി കിട്ടും. അവിടുത്തെ സാലറി എന്ന് വെച്ചാൽ 1.5 ലക്ഷം തൊട്ട് 2 ലക്ഷം വരെ സാലറി വാങ്ങിക്കുന്ന.
Regula is one of a growing number of nurses who are migrating abroad for work. In Kerala, the trend dates back to the 1970s, with Gulf countries the favoured destination. Now the EU and America are increasingly popular. The southern Indian state of Kerala is well known for training nurses for export, and the local economy has prospered from remittances. However, communities have felt the loss of skilled staff.
ജീവിത ചെലവ് കുറവാണ്. അപ്പോൾ നമുക്ക് കിട്ടുന്ന സാലറി വെച്ചിട്ട് നന്നായിട്ട് മെയിൻറ്റെയിൻ ചെയ്ത് പോകാൻ പറ്റും. നാട്ടിലെ കാര്യവും നമ്മുടെ കാര്യമൊക്കെ മെയിൻറ്റെയിൻ ചെയ്ത്.
In spite of the burgeoning private medical colleges across the country, India as a whole suffers from a shortage of nurses.
So they are going abroad for a greener pasture because where they are able to get I think there are instances in some of the districts, each house is having one nurse who is working abroad. They have realized the investment on nursing, which is going to pay a dividend. That's why the families, they go for the loan from the banks, nationalized banks. So the parents, they know the secret of because she is going to get a job, a good job in abroad, and she will be able to send more money. But at the same time, this has seen some negative impact. At present, there is one nurse per 1,000 population. It is estimated. So therefore, the WHO has enacted the international code of practice.
The aim, to put in a nutshell, is really to have a win-win situation regarding health workforce international migration that on the one hand considers the right of every individual to leave their own country and to migrate, but at the same time to also account for strengthening health system in countries where people tend to live, where there's a strong migration and already a weak health system. In India, there has been achievement in terms of increasing the training for medical graduates, to increase the number of doctors, nurses. I think a further step, initial efforts have already done to be sure that all the needed doctors and nurses are where they are needed, especially in rural areas. The designated national authority will help also monitoring of the code.
Under the code, countries report every 3 years. Latest reporting figures show an increase of around 34% in countries establishing national authorities to monitor implementation of the code. 2/3 of them are taking steps to report on the code. India and Ireland are 2 of the 5 countries prioritised by the WHO in the EU-funded Brain Drain to Brain Gain project. Its aim is to build momentum and accelerate progress in the implementation of the WHO Global Code.
In May 2014, Member States requested the Director General of the WHO to develop and submit a global strategy on human resources for health in May 2016. In that strategy, we reaffirm and recommit to the principles and articles of the WHO Global Code of Practice.
Another country taking part in the project is Uganda.
Each country should maintain an ongoing health workforce information system which enables the country to monitor on an ongoing basis who has joined training, who has left training because of retirement, who has joined service, which part of the service are they, and what are their plans to stay or leave the service. And in that way, it will then be possible to make 5-yearly plans in terms of getting the right people in the right places all the time.
നല്ല സാലറി ഉണ്ടെങ്കിൽ കേരളത്തിൽ തന്നെ വർക്ക് ചെയ്യാനാണ് എനിക്കിഷ്ടം. കാര്യം എന്ന് വെച്ചാൽ സ്വന്തം നാട്ടിൽ തന്നെ ജോലി ചെയ്യുന്നത് അതൊരു വേറിട്ട കാര്യം തന്നെയാണ്.
You know, the streets where you have grown up, the places, you know, definitely you will miss them. But the good thing is that we can improve the things. At the end, we have to go to Pakistan and we can improve the things over there.
Going forward, the World Health Organization hopes to make stories of returning doctors and nurses and strengthened health systems more commonplace.
We need to strengthen our evidence and strengthen our dialogue, and we welcome continued investigation by countries, across countries, to enable us to find the solutions for the future.
The code is critical to achieving universal health coverage. The Brain Drain to Brain Gain project is supporting countries to implement the code, helping countries better understand and address patterns of migration that are increasing and growing more complex. Its lessons are likely to be of relevance across countries and regions.
I love my patients. I love my job. I enjoy my job. I enjoy my patients as well. So responsibility as a national of Pakistan, responsibility as a doctor, and responsibility as a human being. We have to struggle every time to bring about positive changes in the environment where we are working.